I'm Jill D'Agostino, and I am a licensed mental health counselor and certified autism specialist here at Spanish River Counseling Center. A question I get asked a lot is, what is therapy? So the best answer I could say is that therapy is an evidence-based approach to helping people solve some of their life challenges, such as anxiety or depression, or maybe someone's experienced a trauma, a past trauma that they want to help sort through and figure out some skills to help move forward and help them achieve the kind of life that they wanted to have. Another question I get asked often is, what is the difference between therapy and life coaching? Basically, to sum it up, a therapist has gone through an extensive series of education and has a lot more qualifications than a coach. A coach also goes through some education, just a different approach. From a therapy standpoint, therapists cover evidence-based approaches and deal with life challenges that people are dealing with. And a life coach is more of an approach of helping people solve immediate problems and help them to achieve their goals in life. From a therapist's standpoint, techniques are used such as CBT, which is cognitive behavior therapy, or even psychoanalysis. And again, a life coach is going to focus specifically on tools that will help you solve problems in the immediate. A therapist will delve back into the past and help you figure out where something might have taken a different course of action that you didn't want it to happen, and you've been dealing with the ramifications of that. So therapy digs back into the past. Coaching focuses here on the specific and helping achieve goals. That doesn't necessarily mean that a therapist isn't also going to help you with life goals, just a different approach. So an interesting thing about the different approaches to therapy, there's cognitive behavior therapy, there's dialect behavior therapy, there's compassion-focused therapy, you name it, there's a gamut that cover those immediate problems such as depression and anxiety. When you're moving to things that are more severe, and it could be any level of trauma, and in our field we talk about a little t, which is a little trauma, and a big T, which is a big trauma. Somebody might not consider something traumatic that happened to them as being a trauma. It just depends on how it affects the person. I think we mostly think that a trauma is experiencing a horrible car crash or being part of a hurricane or a flood or seeing someone that you love be killed. Little t's can be things like being bullied at school. That could be a traumatic event that affects you. When we're dealing with traumas, a very successful tool to use, other than basic talk therapy, which would be those that I previously mentioned, that would be using something called EMDR, which is eye movement and desensitization and reprocessing. Some of the things that therapists deal with are depression, anxiety, and trauma. And I often get asked, how does one know when it's like they're in need of therapy? The best thing I can say is, if you're feeling that your life is being altered in such a way that you're not achieving the goals that you want, and you're suffering in your relationships, or you're finding it hard to get out of bed, something that you're preoccupied with, and it's something that you don't want to be preoccupied with, therapy can help you sort through that and preventing you from living the life that you want to live. So when those types of things happen, that's when we know that it's important for us to get some help. And therapy is a great way to do that. Another question I get asked is, how long is a therapy session? Most people think that a therapy session is about an hour, when in all actuality, a therapy session is called an hour. It's really only 45 to 50 minutes, and that's so the therapist gets a little bit of time in between clients to sort of take notes and regroup and prepare for the next person that's coming in. Another question I get asked is, how long is someone in therapy? I would say that that really depends on the circumstances, and when I have someone that comes in, I ask them for the next time they come in to come in with their goals for therapy, what they'd like to achieve. That sort of gives me an idea of which direction we're going, because I could talk about anything. I want to make sure that we're talking about the things that the client really wants to talk about and that they're dictating the topics of importance. I've had clients that are 3 to 4 sessions, and I have people that are in the hundreds right now. Some people solve one challenge and then they want to attack another one. The average research says is about 6 to 8 sessions. Like I said, could be anywhere from 3 to 4, could be up in the hundreds, just depends on the individual client. Another important factor when we're talking about therapy is the therapeutic relationship. That means the relationship between the therapist and the client. Research has proven that that is the number one important factor. Above any skill or any technique that a therapist could teach a client is that how that comfort level and trust is between the therapist and the client. Both need to feel comfortable. If that is not taking place, then more often than not, goals are not going to be achieved and problems are not going to be solved. That is the number one important factor. Part of that is that if you think about it, you're coming into a complete stranger and you're sitting down and you're talking about the most intimate details of your life. And if you don't feel comfortable with that person, then nothing is going to happen in a positive way. So having that therapeutic relationship is extremely important. I would encourage people, if you do come to a session with any therapist and you're not feeling it, please don't get discouraged. Try somebody else, because that could be that just wasn't a good fit. And some therapists will say, you know what, I don't think I'm the right person for you. And that doesn't mean that you're too far gone or that there's too many problems. It just means that this therapist and the client are not vibing together in an appropriate way or in a way that would solve their problems. Being part of a Christian counseling center, one of the questions I get is, shouldn't I be able to just pray and have God solve my problems? Like, why would I need therapy? It's an interesting thing to consider. In Isaiah, Jesus is referred to as wonderful counselor. The word counselor is used in Isaiah. And if we think about it, as we read scripture, there's numerous occasions where Jesus is referred to again as a counselor. And let's face it, he is counseling all the time. He's guiding, he's leading, he's healing the brokenhearted. And what better counselor could there be than Jesus? I can't tell you how many times that I've been in session with someone and they will bring up a topic and I will be like, wow, I can't believe that you just said that. I was just getting ready to address that situation. And we're not talking about something general. We're talking about something very specific. Or I will bring up something to someone and they'll say, I can't believe you just read my mind. And I believe that in this counseling center, at a Christian counseling center, Jesus is working through each one of us as a therapist to help the individual. And so I believe that Jesus thoroughly endorses counseling. Oftentimes people ask me what takes place in a session, and I think that really depends on the individual therapist. So I really can only speak from my perspective. I tend to allow the client to be the expert. There is no possible way that I could know my client better than they know themselves. So I will follow their lead. If I will say to a client, if they're asking me for advice and what they should do, it's not my goal because I don't live with them. I don't live in their back pocket. I want to teach them the skills in order to make the best decision for them. And again, I cannot possibly know them as well as themselves, right? So my goal, instead of driving the car with a client, would be to be the passenger in the seat while they're driving. And I can say, oh, hit the brakes a minute here. Remember when you said what you said last week? Could that be at play here? Or, hey, I'm just saying, could this be a possibility? Did you think of it from this perspective? The whole intent is for them to come up with the solutions on their own. And also, therapy does not have to be like it is sometimes that you see in a movie where the therapist sits very stone-faced and takes their notes and says, how does that make you feel? That is not my approach at all. I tend to be more laid back we could be talking about something really serious, and then again, we could be having fun. I tend to like clients to be in charge and to have some fun. It's very participatory. It's never just me talking, and it's never just them talking. It's imagine that I'm throwing a ball to them, they're throwing a ball back to me. It's highly interactive and highly engaged. I tend to be sort of a believer that when we are in session, we're planting seeds, and those seeds will grow inherently, whether or not you do anything outside of these four walls. The more nourishment and water you give those seeds, i.e., thinking about what we talked about in session, the more likelihood you're going to experience a more rapid change in your life. And how do we do that? I will say that I'm a big proponent of homework. And this is not like write me a 5-paragraph essay on a particular topic. These are usually short little worksheets that will help you nourish and water those seeds for when you're not in session. Because most of those aha moments that one experiences happen outside of the four walls of therapy. They usually don't happen within. So someone might be driving down the street and they'll be like, hey, and they'll have this aha kind of wow moment, and they'll come in and say, oh, I realized, and I was like, yes, and that's how we know we've made progress. Here at Spanish River, we are also able to do telehealth sessions online, and that can be DBT or that can be any other modality of treatment. The advantage to doing that is that as a therapist, I get a wonderful insight into the client's environment. I've had teenage girls who have taken their camera and showed me their room. I've met pets. I've met siblings. I've gotten to hear someone play their guitar or play their piano. So it really helps me to get a better understanding of them. And interestingly enough, research has shown through COVID, when all of us were doing telehealth sessions because we weren't in the same room with people, that therapy has been just as effective. So if somebody's thinking that, oh, I don't know if that's going to be as great as being in session, research has proven that it is absolutely fine. And also, you get a better read on people's emotions because you're seeing from here up, and the face will tell a lot. When someone's trying to decide whether or not they want to take on therapy and meet with a therapist, I think it's the therapist's discretion to determine what modality might be best. And that might not be determined right away. Sometimes that therapeutic relationship that's extremely important to successful treatment is going to be based on the therapist getting to know what might be best for that client. And so the client might come in specifically saying, I want DBT, or I want EMDR, or I want CBT, and that does happen quite often. And so a therapist will respect the client's wishes. However, if they think that there's something that might be better, once that relationship is established and that trust is established, the therapist is usually able to say, hey, I know you came in here wanting DBT. I think that EMDR might be a great approach. Let me explain to you what that is.